This one is for the guys. How many times did you get up to pee last night? Or if you are someone who sleeps next to a guy, how many times did he get up to pee last night? For many, many men, that frequent urination is not just an inconvenience, it is the beginning of a bigger piece of your health story. And it specifically has to do with your prostate health. This is National Prostate Awareness Month, and so I wanted to make sure that I at least did a video to show some love to our men's health realm, and specifically as it relates to medications. So did you know that 14 million men in the United States experience some type of urinary symptom from having an enlarged prostate? But the good thing is that we do have medications for that, and we also have some supplements that could be helpful for that as well. Not all of the options are created equal. And so in this video, I'm going to talk about the multiple options that could be utilized for helping someone who may have an enlarged prostate. If you are new to watching the videos on my channel, my name is Dr. Wallace-Gay. I am the community's pharmacist. And on this channel, I help you finally make your medications make sense so that you can move from confusion to clarity, from overwhelm to confidence when it comes to taking all these drugs, or thinking about, do you even need to take these medications? And if you do, I want to make sure that you take them safely and with confidence. So by the end of this video, you will know how these medications work, what are some simple side effects associated with them, what are some things to watch out for, and even some questions that you may be able to ask your provider or your clinician when you go into your next visit. All right. So let's first talk about BPH, which is benign prostatic hyperplasia. And the word benign means that it's not cancerous. The symptoms are obviously frustrating, but it is not cancerous. And it doesn't necessarily mean that it's going to progress to cancer. Of course, the prostate being the gland in your body. And then hyperplasia refers to the fact that the cells of the prostate gland have started to multiply. And so that multiplication, that rapid multiplication of those cells leads to an enlargement in the gland, making the gland bigger. And so what this means is that it can start to squeeze or press on your bladder, and that could cause you to have to urinate more frequently or have a weak stream or dribbling, a start and stop type of stream, lots of nighttime trips to the restroom, things like that. It is more common in men who are 50 or older, but I mean, this can happen in younger guys as well. And the reason why this matters is because if it goes untreated, those symptoms, which are very annoying, can affect your sleep, which can lead to other issues down the road, just lack of sleep or lack of quality sleep. It can affect your bladder health, and it can also affect how your kidneys work or how your kidneys function. So we want to make sure that we try to control that enlargement of your prostate gland as best as possible. So now I'm going to talk about the main two families or classes of medications that we utilize when we know that someone has an enlarged prostate. And there are levels to this. Like, the prostate is not going to just become enlarged overnight, right? And it's not going to go from small to big within like a week. So if your prostate gland is enlarged, but not quite to a certain threshold that your clinicians will be looking for, they may first start you on a medication called Tamsulosin. The brand name for that is Flomax. There are other medications that are similar to Tamsulosin, but we don't use them nearly as often for this reason, for the prostate enlargement. But just so that I can be complete, those other two names of medications are alfuzosin and doxazosin. But again, Tamsulosin, which is the generic name, Flomax is the brand name, is by far the most common medication that we use for this indication. There's also a medication called terazosin, which I wrote that one in my notes, but I forgot to mention. So there's technically 4 drugs that fall into this family, and they all end in SIN. But Flomax is the most common one. So these medications specifically relax the muscles in the prostate, as well as the muscles in the bladder neck, and that's going to help improve urine flow overall. And you'll start to see some benefits of this in like days, within the week. And so it acts pretty quickly in that regard, which is really nice. But one thing that is potentially a side effect with these medications is that people start to have dizziness, maybe some fatigue. Some of the medications in this family have been used for lowering blood pressure because they also help relax the blood vessels. And so you might notice that that dizziness is because your blood pressure might be getting a little bit low. So you always want to keep a watch on that. There's also something called retrograde ejaculation that can occur with these medications, which sounds really painful. It sounds horrible, but it's not painful. I have not experienced it myself, but I know based on our data, our literature, our patients, this is not something that's painful. All it means is that during ejaculation, instead of the ejaculate coming out, it flows backwards into the bladder. And so you just may see less of it. So that's called retrograde ejaculation. And again, it's not something that's painful, but it could sometimes affect fertility or your experience during ejaculation. So just know that is something that can happen. A good tip with this medication, because it causes sometimes dizziness and fatigue, it may be best to take it at bedtime, just so that you're already going to be laying down, going to bed. You don't have to worry about if you're feeling tired or if you're feeling dizzy, trying to function in your daily life. Okay, so that is that family of medications to start. The next family of medications specifically help to shrink the gland. So the first family, Tamsulosin, Flomax, those medications helped to relax the gland. These medications help to shrink the gland. So your clinician may start these medications once your prostate has gotten to a certain size. And they're like, oh, well, at this point, not only do we want to relax the muscles, but we also want to reduce the size of the gland. And so the main medication that we use here is called Finasteride. The brand name for it is Proscar. And then there's another generic medication called Dutasteride, and the brand name for it is Avodart. And so these two medications specifically, again, shrink the prostate gland by lowering a certain hormone in the body that may be contributing to the growth. These take a little bit longer to work, whereas the first family I talked about, you'll start to see some benefits within days, and that's related to your symptoms. So reduced urinary frequency, all of that. These medications, it's going to take around 6 to 12 months because we are actually trying to change the size of the gland and shrink it. And so that just takes a little bit longer to have its effect. So it may take 6 months on the low end, 12 months on the high end just to see some effects. Now, side effects with this, because this medication is blocking a hormone that specifically leads to development of testosterone, you may see low libido. You may experience erectile dysfunction. You may have reduced ejaculate, and also some chest or breast tenderness may be associated with this medication as well. It is not a reason not to take it because everybody does not experience these symptoms. Everybody does not experience them to the same extent. So if your prostate is enlarged and it's causing you an issue, my tip would be to try it, start it, see how you feel on it. And if you're like, no, it's not doing it for me, it's causing issues in other areas of my life, then potentially talk to your clinician about coming off of it or switching to something else or thinking about some alternative options. But again, this one is going to be best for men who have larger prostates, and this specifically can reduce your need for having to go in and have surgery. All right. The other thing that may happen, and that does happen in a lot of people, is that they're on combination products. So there is a combo brand name that has Dutasteride, which is the one that shrinks the gland, and also has Tamsulosin in it, which is the one that helps relax the muscles. But it's going to be really expensive as a branded product. That doesn't mean that your insurance won't pay for it or that you shouldn't get it if you want to reduce the number of pills that you're taking. But if you find that your clinician is putting you on 2 medications to help with your prostate or your BPH specifically, then just know that there is a product out there that has both mechanisms in it in the form of 2 medications in 1 pill. So this will help with quick relief and also long-term with shrinking the gland because it's got both of those things stacked in the same pill. Now, those are the 2 main families of medications that we're going to use for BPH. However, there are some other medications that could have benefits if you are someone who has an enlarged prostate. So specifically, medications that are used for erectile dysfunction, like tadalafil, which is Cialis, or sildenafil, which is Viagra. So these medications can help with both urinary symptoms as well as erectile dysfunction. And fun fact, Viagra was first marketed for high blood pressure. And so we know that it reduces the blood pressure because of, it's the way that it works in the body. And so because of that, not only is it relaxing blood vessels, but it's doing the similar thing to what Tamsulosin is doing, is relaxing those muscles around the bladder and relaxing the gland itself, the prostate gland itself. And so that's going to be good because it is going to improve the blood flow and also help you to have less frequency in urination. And then if you are having some issues with erectile dysfunction, it will help in that category as well. And so with this, it may take maybe a few weeks to start to see some benefits from it, but it will work fairly quickly. Side effects, things that you might see when your blood pressure gets maybe too low, like headache. Some people get flushing of the skin. Indigestion is a weird one that we see sometimes with this medication, as well as maybe some back pain. So just be on the lookout for some of those side effects. If you're on this medication for whatever reason, just know that those things can happen. Okay, the next medications I want to talk about, these are specifically for the urinary, like trying to stop you from going to the restroom. So it's not really doing much for the prostate gland itself. It's not shrinking it. It's not relaxing the muscles. It's shutting off. It's telling your body to stop urinating so frequently. So these are things like oxybutynin, tolterodine, sulfenicin, and mirabegron. So these medications are specifically used for urinary incontinence. And they all have their brand names associated with them, but we might use these in BPH specifically for individuals who have really strong bladder symptoms, like they are having leakage that's causing them issues, frequency, you're in urgency, like you're doing something, all of a sudden you just got to go to the bathroom. So we want to use something that's going to essentially kind of stop you from that urgency or that frequency of having to go. So again, oxybutynin, tolterodine, sulfenicin, and mirabegron. All right, so some side effects we see with these medications, because they are not only stopping fluid flowing from your bladder, they are also stopping fluid other places in your body. You might have dry mouth, you might experience constipation, you might experience blurry vision with some of those. And the last one, mirabegron, specifically might increase the blood pressure a little bit. So if you're on any of those medications, just watch out for that. And we might add these medications on, again, for that person that's just having really strong urinary frequency or urgency, and the Tamsulosin by itself is not getting the job done. Okay, so I also want to talk about supplements, and just know that supplements are not regulated by any governing body like prescriptions are. So the evidence in them really varies. We don't have as much data on them. And you can just go and buy these from your pharmacy or your local health store or health food store. But I really, 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 really strongly encourage you not to start one until you talk to your provider or your pharmacist or someone who can see your whole health picture and all of the other medications that you're on, because they may be interacting with some of your other drugs. So the main one that I'll talk about, and again, just very briefly, is saw palmetto. SAW, palmetto, PALMETTO. I'll put that on the screen. But this one is by and large the most popular one. It has been in some larger studies. There's some data out there, but the results are kind of mixed. I've had patients that are on it and they swear it works really well. And I've had other people that are like, I can't really tell a difference. So it's worth a try if you are into supplements and you want to take that route. But again, just make sure that you talk to your clinicians that are taking care of all of your health conditions to make sure that it's not going to interact with something else that you're already taking. There are some other ones out there as well. I think, if you look into something that has a claim of helping with the prostate, just take that information into the doctor's office or into the pharmacy and just ask if they could look into it for you and help you determine if it's something that could be beneficial. All of the ones I looked at, there's things like pumpkin seed, pygeum, which is an African plum bark. There's another one called beta-sitosterol, but all of them have very varied evidence, I'll say that, but not very strong in any of them. So they all say that they may help a little bit with frequency of urination, especially maybe at nighttime. So just keep that in mind. They may help. They're not going to be a replacement for the medications that we know are tried and true we have lots of data on that are going to help with the symptoms and that are specifically going to help if the gland is too large and we need to shrink it down. They're not going to replace those. So just know that these are meant to supplement, not substitute your medications that your provider may be giving you. Now, I have something called a medication mind map. And what this does is help you look at these medications just the way that I've described them. What is the condition that you're focused on? So BPH, what are the medications that you're on for that? What are your doses? When are you taking it? What are the side effects? All of that. What is this med doing? And not just, oh, this med is treating my BPH. No, you should be saying this med is shrinking my prostate gland. This med is relaxing my prostate gland. Whatever specifically that drug is doing, it'll help you to really conceptualize that a little bit better so that you can understand it and quickly see what you're dealing with your medications for one full condition. And then you can put all those maps together as a full body picture of all of your medical conditions and all of the medications that you're taking for those. So you can put, everything on that. Supplements, prescriptions, whatever you want to. And if you want a link to that free starter guide for a med map, just check the description box below. You can download my free guide and just start to build out that med map and just really see how much more clarity you have after you've written it out or typed it out. You can really see at just a quick snapshot view what this medication is for and really what it's doing and what are all the aspects of the medication. So with that in mind, I just want to end with a really quick story. And I had a patient, it's been a while ago now, but he was a pastor and he came in and he ended up in tears because he was like, he would be in the middle of church or after church in the middle of like the repast for a funeral or right after church before the next service. And people were trying to talk to him. And you know how that is, like everybody wants to talk to pastor. And so, he was having such urgency that he had wet himself a couple times at church and was just, obviously so embarrassed by that. And a couple of times, like, it was happening before he even realized it. And he had not even considered that it could have been his prostate. He was just thinking that it was his weight because he was a larger gentleman. And so, I talked to him and we did talk about like the weight and how that could be pushing on his bladder. We talked about some other things as well. And just as kind of a last note, I was like, have you ever had your prostate checked? Or like, has anybody ever talked to you about your prostate? He was like, no. And so his next doctor's visit, like he explicitly asked about his prostate because what happened was he had a really great doctor. So it wasn't that, but each appointment was really so heavily focused on his diabetes and his high blood pressure, which were not controlled, which could have been contributing to that as well, that the prostate piece was not being addressed. It was being unintentionally overlooked. And so talked to him about the prostate. Turns out he had some enlargement of his prostate gland. So he had the examination done. There was some prostate enlargement. He was started on medications for it. And this was one that like we were both in the exam room just like crying. And it does not take much for me to cry. I will say that. But definitely when somebody is crying because they feel that I have helped them really realize something and empowered them to ask questions when they go into their physician's visit and talk about their medications and talk about their health conditions, that really moves me. And it really moved him. I say all that to say, if you are having issues, don't just write it off as, oh, maybe it's because I need to lose some weight, or maybe it's because my blood pressure is high, which those things could also be true. But especially now, as we're rounding out Prostate Awareness Month, this is the best time to be very keen and very tuned into what is happening with your prostate health. And just talk to your clinician and say, hey, could we do a prostate check? And even with that in mind, not only checking, do you have BPH or could that be a contributing factor, but making sure that you're getting your prostate screenings done as well. So your PSA, which is a blood test that can be quickly done, and really following down the route of what's going to be the best screening tool or screening format for you, your history, your family history, and your current situation. Thank you for watching. I'll see you in the next one.